Hello, my name is Natalie, along with Joanna, and we're going to talk about tuberculosis today. What is tuberculosis? Tuberculosis is a bacterial infection that can spread through the lymph node system and bloodstream to any organ in your body, but it is most commonly found in the lungs. Most people come in contact with it but never develop the symptoms. It mainly becomes active in those with a weak immune system, such as HIV or elderly adults. When it becomes active, if it's left untreated, it can be fatal. Now we're going to discuss the etiology of tuberculosis. The scientific name is Mycobacterium tuberculosis. The Gram stain is positive. It is an acid-fast bacteria, which means its impermeability by certain dyes and stains. This makes it difficult to determine a stain for it. It's an obligate aerobe, it's non-motile, and it's a serpentine pleomorphic bacillus. With it being an obligate aerobe, it allows it to survive in the upper lobes of the lungs, and that's where it flourishes, and that's why we most commonly find it in the upper lobes of the lung. Now we're going to discuss the morphology. It is enveloped, and this means it has an additional layer beyond the peptidoglycan, which is rich in unusual lipids, glycolipids, and polysaccharides. Novel biosynthetic pathways generate cell wall components such as myocholic acids, psychosericic acid, phenolglycerol, lipoarabinomannan, and arabinoglycan that contribute to many mycobacterial longevity, which also triggers inflammatory in the host that reacts and acts in the pathogenesis. It's a facultative intercellular parasite of macrophages. The viral genome consists of 4,411,522 base pairs that are long and 3,924 protein coding sequences with high GC content. It has a slow generation time to 15 to 20 hours. Now we're going to discuss the symptoms that come along with tuberculosis. There are two different phases of tuberculosis, latent phase and an active phase. In the latent phase, you will never see any symptoms because it's just sitting and waiting. In the active phase, you'll have coughing that lasts up to 3 weeks or longer, also coughing up blood. You have chest pain or pain when breathing or coughing. You'll see weight loss, fatigue, a fever that includes night sweats and chills, and loss of appetites, which goes with weight loss. Also, tuberculosis can affect other parts of the body that includes kidneys, spines, or the brain. When it occurs outside your lungs, the symptoms can vary according to what organ is involved. For example, if tuberculosis was in your spine, you may have back pain. If it was in your kidneys, you might see blood in your urine or also have back pain. So it matters what part of the body it's in, and the symptoms will vary with that. As we've discussed in the previous slide, there are two phases of tuberculosis, an active phase and a latent phase. And this latent phase is where the reservoir comes in. The body will store the tuberculosis bacteria for many months, and you'll never see any symptoms. You'll only be able to know if you have it is if you have a tuberculosis test done and it comes back positive. During this time, the body is fighting the infection so that the bacteria will not grow and become active. If it does become active, that is when you'll see symptoms and actually feel sick. The only times it will become active is if you have a weakened immune system or have HIV, and having a weakened immune system can be caused by stress, you have another illness at the time, or any number of factors. Now we're going to discuss how tuberculosis is transmitted from one person to another. It is mainly spread through the air through singing, talking, sneezing, coughing, wherever you can get air-to-air contact to someone through their saliva mainly. This means those in high contact, which is family members, close friends, relatives, loved ones, those are the ones that have a higher risk of getting tuberculosis. It is spread easiest in close spaces over a long period of time, so mainly in high crowded areas, transportation, vehicles, and things like that, where you're in a small space surrounded by people who may be coughing or have any number of symptoms. Now we're going to discuss the treatment of latent tuberculosis. Most tuberculosis treatments are done through tuberculosis chemoprophylaxis. All this means is that the chemical prevention of tuberculosis by the use of chemical agents such as drugs. During a 9-month period, there are 2 stages of treatments. During the first 2 months, the main objective is to kill as much bacteria as possible. To do this, doctors will prescribe multiple drugs at one time to kill as much bacteria as possible. During the last 4 months, the main objective is to kill any remaining bacteria. Still using multiple drugs, this allows for the bacteria to be targeted in multiple ways. It also makes it less likely that the bacteria will develop a resistance to treatment. There are 4 treatment options: INH, RPT, and RIF. Now we're going to discuss isoniazid, also known as INH. It is an antibacterial drug that has been in use since 1952 for the prevention and treatment. The duration is 9 months. Symptoms using the drug includes loss of appetite, nausea, vomiting, cramping, blood in stool or urine, rash, yellowing of skin or eyes, and tingling or numbness in hands or feet. This drug is used to prevent the bacteria from making mycolic acids, which are needed to form the cell walls of the TB bacteria. When combined with an enzyme, it interferes with the cell metabolism of the bacteria. As a result, the bacteria dies. This is a time-sensitive drug. It must be taken at the same time every day with food. The way the drug works, it works by actually killing the bacteria. This can also cause the host cells to have a mutation or damage themselves, causing problems like jaundice or liver issues. If this happens at all during the course of treatment, go to your doctor. Now we're going to discuss rifampicin, or better known as RPT. It kills bacteria by inhibiting bacterial RNA polymerase. It does this by eliminating the TB bacteria while leaving the host RNA polymerase unaffected. Has a long life in serum. Due to this, it is administered less frequently. Its half-life is 5 times of rifampicin. The criteria are 12 years of age or older, cultured positive, non-cavitary pulmonary tuberculosis, which this means that there is no gas filling the lung in the center of a nodule or consolidation. Susceptibility to rifampicin, ionized, and pyrazimidine, and HIV negative. Having a criteria for eligibility allows only for those people who the drug will work best on to get the treatment, so work for them instead of against them. Now we're going to talk about rifampicin, also known as RF. It is recommended by the World Health Organization as the first-line treatment for tuberculosis. It was first synthesized in 1965 by an Italian company that developed rifampicin and approved by the FDA in 1988. It is a long-acting derivative of rifampicin and is similar in structure to it. Clinical studies have shown that it could shorten the current 6-month treatment for latent tuberculosis. The class that it is in antimycobacterials, which all it means, it works by killing the bacteria that causes the infection. Now we're going to talk about the vaccine used to prevent tuberculosis, which is called BCG. It provides immunity or protection against TB. It is made from a live weakened strain of Mycobacterium bovis. Using this, it will allow the body to build up the antibodies it needs to fight against the infection if you come in contact with it. It was developed in the 1930s and is still the only vaccination available today. It is not used in the U.S. because it can cause a TB test to be a false positive. Most often, it is best used on infants and small children. To conclude this presentation, we're going to talk about how to prevent tuberculosis. If you have it, avoid crowded areas, which includes public transportation. Sleep alone in your own room that is highly ventilated. Spend time outdoors and in the sun. Cover your mouth when coughing or sneezing. Use your elbow or a tissue or a napkin, never your hands. Wear a mask to protect yourself and others. And finally, make sure to have a well-ventilated house to ease the coughing. Thank you so much for watching this presentation today, and I hope you learned a lot more new things about tuberculosis.